Okay, now it's on.
Okay. So, Benoit, how would you say that the average person in Cité Soleil would look at life before the Lamp for Haiti was there, and then after Lamp for Haiti was there?
As from past stories, I heard from Pastor Tirani and different people that are active down there, before Lamp, health was not possible. It was expensive. People had to go long ways to go get service, and it was not free. So they have to pay for transportation, they have to pay for exams, and they have to buy the medication, and medication is really expensive. So from past stories, I see before they had problem. They had problem with medical issues and clinics, because before there was no clinic down in Bonnef, especially in the area where we're in, because we are the only clinic that is functioning down there right now. So if I were to be a resident down there, I would thank God daily, because there's a place I could go and get a medical service for free, and then you don't get that all around Haiti.
So if it's a question of having to pay for those medical services, you grew up, initially you've told me that story of how you came to Port-au-Prince, but you grew up in an area essentially, at least in your earlier days, when there was no health care. And so if one is faced with the choice of having to pay for health care, what do people typically do?
Right now, a lot of people can't pay for health care.
Yeah.
But now, and then see, as time is passing by, healthcare is getting more expensive. Most people right now are not being able to go to a hospital to get a healthcare medication they want, because it's very expensive. In my early age, I didn't have that, and I didn't care about that too. And now as I grow up, I see you need to be healthy to keep working, to keep your body in shape and everything. So
yes.
One way to do it, I mean, you can't get free services here, and you have to pay. And then only when you have money you can go. Because I remember sometime I couldn't even take my children to see their doctor, because sometimes I don't have the money. So I only take them when the money is there, and when the money is not there, I just stay and then don't do anything else.
Got it.
So I think the people down there I think the people down there in Bonnef, if I was one of them, I would really appreciate that service. I would really appreciate that service, having to bring my children to a clinic where they can get free services without me having to pay, without me having to worry about where I'm going to get the money to do this and that. So I would be very appreciative of that service that Lamp is providing down there.
And I wonder if you would, if we could switch gears for a little bit and tell me about the staff. In particular, tell me about Dr. Hippolyte. How would you characterize him?
Dr. Hippolyte is very professional. That's the first thing I can say. He's very professional, and he's doing what he's doing with passion. He has a passion for what he's doing. And then from different people, from different patients that has come, that has been talking to me personally, they have complimented me for him. They said he's one of the best doctors we've had so far, and he's very professional, and they really appreciate what he's doing.
Okay. And how about the rest of the staff? What's your feeling about them, particularly given what we talked about before with the oftentimes very insecure situation down in Cité Soleil, yet they keep coming to work every day?
Yeah, that's one side that most of the time I thank them, and most of the time Dr. Hippolyte does that too. And then I think most of the time we should be thanking them daily, because it's a risk. It's a risk that they're taking, since they have been robbed twice already, but that did not stop them from going down there. So it is good. We do have a staff that are dedicated to do what they are doing. They are really dedicated to that. Otherwise, they will all be gone already, because they've been robbed them before, but that did not stop them. I remember the 1st of February when we were robbed. That did not stop us from going in. instead of going back home, we went in instead, and then we complete the day when we give the service with a happy heart, with a smile and everything like that. So nobody would see in our face that we were robbed and we were afraid and everything like that.
Yes.
So we went in, and then we give, with a happy smile, we give the day, and then we went back home.
Okay.
And then the next day we were in the vehicle going back again. So
wow.
the security issue is not stopping us from going there to do the service, because we know the people that are robbing us, they are not the one that needs our service. They are trying to stop us from giving that service to the population. And I know most of them, sometimes when they're in need of healthcare, they go down there to see us.
Okay. Good.
So the staff, they are really dedicated. They are really dedicated to the service, and since I've been in, some tremendous changes has made through their character, through their participation, and they are now more involved in what is going on.
Okay. Great.